In Unit 5, we will discuss the circulatory system as two separate but interrelated topics. Part 1 concerns the heart and the blood vessels, while Part 2 focuses on the blood, lymphatic, and immune systems. Doctors who treat disorders of the heart are called cardiologists, and surgeons who repair the heart and/or damaged blood vessels are called vascular surgeons or cardiothoracic surgeons. The objectives for the circulatory system are to list, define, and apply word parts to build and analyze medical terms associated with the circulatory system, write terms for selected structures related to the circulatory system, and match those terms with their descriptions. The circulatory system is also referred to as the cardiovascular system. Its primary functions include distributing blood to all areas of the body, delivering needed substances to cells, and removing wastes. This slide shows the anatomy of the circulatory system. As you can see, the organs of this system include the heart, the arteries, the capillaries, and the veins. The heart is located in the mediastinum, which is located to the left side of the chest and directly behind the sternum, which is the breastbone. The heart is about the size of a fist and is shaped like an upside-down pear. The heart has a right side and a left side. The heart is divided into its right and left sides by a wall called the septum. The right side of the heart delivers blood to the lungs, where carbon dioxide, CO2, is exchanged for oxygen. The left side of the heart then pumps oxygenated blood to the body. The heart is divided into 4 chambers, 2 atria and 2 ventricles. The 2 atria are known as the left and right upper chambers. Blood returns to the atria in the heart through the venous system. The 2 ventricles are known as the left and right lower chambers. They're the pumping chambers, meaning they pump blood away from the heart. Blood exits the ventricles into the arteries to be circulated throughout the body. You might want to think about blood vessels as the pipes that circulate blood through the body. Blood vessels are divided into 3 categories: arteries, capillaries, and veins. Arteries are large, thick-walled vessels which can dilate or constrict. Arteries carry blood away from the heart to the rest of the body or to the lungs. Most arteries carry bright red blood that contains a high level of oxygen. Capillaries are a network of tiny, thin-walled blood vessels. They form the connection between arteries and veins. Capillaries reach each cell in the body. It is in the capillaries that oxygen and nutrients diffuse out of the blood, and carbon dioxide and waste products diffuse into the blood. Veins carry blood back toward the heart from either the lungs or the cells and tissues of the body. Most veins carry dark red blood that has a low level of oxygen. The first major condition of the circulatory system that we will discuss is atherosclerosis. Atherosclerosis is a disease in which plaque builds up inside the arteries. Plaque is a sticky substance made up of fat, cholesterol, calcium, and other substances found in the blood. Over time, the plaque hardens and causes narrowing of the arteries. This, in turn, limits the flow of oxygen-rich blood to the body and can lead to serious problems. These problems include coronary artery disease, carotid artery disease, and peripheral arterial disease. In coronary artery disease, the arteries that supply blood to the heart become blocked. When blocked, the patient can suffer angina, which is the medical term for chest pain. It could even cause a heart attack. If the patient has carotid artery disease, the arteries that supply blood to the brain become blocked. When the arteries to the brain are blocked, the patient can suffer a stroke. And with peripheral arterial disease, the arteries in the arms, legs, and pelvis become blocked. When the arteries are blocked, the patient can suffer from numbness, pain, and sometimes infections. Atherosclerosis usually doesn't cause symptoms until it severely narrows or totally blocks an artery. Doctors use physical examination, imaging, and other diagnostic tests to see if the patient has atherosclerosis. Treatments for atherosclerosis include medicines and medical procedures or surgery. Lifestyle changes can also help. These include following a healthy diet, getting regular exercise, maintaining a healthy weight, quitting smoking, and managing stress. The next circulatory condition that we'll discuss is a stroke. A stroke occurs when the blood supply to part of the brain is interrupted or severely reduced, depriving brain tissue of oxygen and food. Within minutes, brain cells begin to die. A stroke is a medical emergency. Prompt treatment is crucial. Early action can minimize brain damage and potential complications. Because strokes occur in the brain, a neurologist would be the specialist who treats stroke. The good news is that strokes can be treated and prevented, and many fewer Americans now die of stroke than was the case even 15 years ago. Better control of major stroke risk factors, such as high blood pressure, smoking, and high cholesterol, is likely responsible for the decline. There are two kinds of stroke, ischemic and hemorrhagic. Almost 90% of strokes are ischemic strokes. They occur when the arteries to the brain are narrowed or blocked, causing severely reduced blood flow called ischemia. Lack of blood flow deprives the brain cells of oxygen and nutrients, and cells may begin to die within minutes. The other kind of stroke is called hemorrhagic stroke. Hemorrhage is the medical term for bleeding. Hemorrhagic stroke occurs when a blood vessel in the brain leaks or ruptures. Brain hemorrhages can result from a number of conditions that affect the blood vessels, including uncontrolled high blood pressure, hypertension, and weak spots in the blood vessel walls called aneurysms. Mini strokes, also known as transient ischemic attacks or TIAs, occur when the blood supply to the brain is briefly interrupted. Many TIAs last less than 5 minutes. Like an ischemic stroke, a TIA occurs when a clot or debris blocks blood flow to part of the brain. Unlike a stroke, however, which involves more prolonged lack of blood supply and causes permanent tissue damage, a TIA usually doesn't leave lasting effects because the blockage is temporary. There are numerous symptoms which occur when the patient is having a stroke. Strokes can result in a variety of neurologic deficits, such as sensory, motor, or cognition. For example, the patient may experience symptoms such as sudden numbness or weakness of the face, arm, or leg, especially on one side of the body. The patient may experience sudden confusion, trouble speaking or understanding speech. In addition, the patient may have sudden trouble seeing from one or both eyes. The patient may also have sudden trouble walking, dizziness, loss of balance or coordination. And finally, a stroke may be accompanied by a severe headache with no known cause. Hypertension is the next circulatory condition that we'll discuss. Hypertension is often referred to as high blood pressure. Hypertension results in damage to organs, by consistently causing high blood pressure in vessels of individual organs. It is typically called a silent killer because many people have it but don't know it. Hypertension can cause life-threatening illnesses like kidney problems, stroke, heart failure, blindness, and heart attacks. High blood pressure can be controlled through healthy lifestyle habits and taking medication if needed. The diagnosis of hypertension is based on blood pressure readings. Blood pressure readings use two numbers, the systolic and diastolic pressures. Systolic pressure is the pressure when the heart beats while pumping blood. Diastolic pressure, in contrast, is the pressure when the heart is at rest between beats. The resulting pressure readings are usually written one above or before the other. A reading of 120 over 80 or lower is considered normal blood pressure. A reading of 140 over 90 or higher is considered high blood pressure. A reading between 120 and 139 for the top number, or between 80 and 89 for the bottom number, indicates pre-hypertension. You may be wondering, when are we going to talk about heart attacks? A heart attack is called a myocardial infarction and abbreviated as MI. Heart attacks are one of the most well-known and common medical problems. In fact, someone in the United States has a myocardial infarction every 34 seconds. The symptoms of an MI include chest discomfort, such as feeling pressure, squeezing, or pain. Sometimes people experience shortness of breath and discomfort in the upper body, either in the arms, shoulder, neck, or back. Another symptom of a heart attack is nausea, accompanied by vomiting, dizziness, lightheadedness, and sweating. Most heart attacks happen when a clot in the coronary artery blocks the supply of blood and oxygen to the heart. Myocardial infarction is caused by the heart receiving too little oxygenated blood supply, which results in organ damage. A blockage that is not treated within a few hours can cause the affected heart muscle to die. Sometimes a myocardial infarction leads to an irregular heartbeat, called an arrhythmia, that causes a severe decrease in the pumping function of the heart. Treatment for cardiac arrhythmias include medicines, a variety of cardiac devices, and cardiac ablation. Here are some key word parts for the circulatory system, along with their meanings. In the third column, you can see some of the medical terms that we can create by combining word parts. You should return to the online medical dictionary to hear the pronunciation and become familiar with the meaning of the created terms. In summary, we defined medical terms related to the circulatory system and described common diseases and conditions with an overview of various treatments related to the circulatory system.